Then on the post-COVID recovery, as we look at revival kicking in, we connect then with the management of Narayana Health. We've got Viren Shetty, who is now joining in. Good to have you on board. Thanks so much for taking time out and joining in. Just give us a sense as to how business is shaping up currently. We understand that you're looking at a sharp loss reduction in 3 of your units. Can you just give us some more perspective on that plan?
Yeah, the 3 key units of ours, the 2 flagships in Bangalore and Calcutta, we have seen more or less an 80 to 90% recovery starting December. And hopefully the numbers are still coming in that we get to a positive EBITDA for our 3 main units. The 3 newer units of ours, the 2 in Delhi and the 1 in Mumbai, one of those has broken even and the other 2 were on track to break even sometime this year pre-COVID. Post-COVID, it could get delayed by a couple more months.
So what is the outlook when it comes to your margin picture, domestically as well as the kind of expansion that you're expecting in the Cayman Island unit?
Sure. Possibly we could end this year maybe with about, definitely I don't think we could do a full margin recovery in the remaining Q4 that we have left. It seems quite unlikely, just given the severity of the losses that we faced in Q1 and for the first half of Q2. But the Cayman was definitely the outperformer there. That was the only hospital we had that benefited from a lockdown, given that it was the only healthcare provider on the island, as well as it was able to cater to almost all the specialties, and there were no COVID patients over there. So Cayman would be the outperformer. The India business would recover, but the full recovery, I would say, is more pushed into 2021-22.
Sure. You've talked about consistent profitability improvement across your mature units. Help us understand how the mature units have panned out. You just highlighted that you do see full swing profitability come in by next year, but if you could give us an exact timeline.
It's difficult given that the numbers are still being collated at this point. As of right now, on a revenue run rate basis, across all the units, we are between 80 to 90% of the major units. Of the smaller units, they are at 100% recovery, but those were on a much lower baseline. What we're looking through the data right now, the outpatient consultations and the inpatient admissions aren't quite there yet. So what's happening is that we're getting a lot of patients who have been delaying their procedures and who are coming in at a lot more severity. So these are the cases that could not be postponed. And so we're not seeing this huge number of volumes in our outpatient departments or huge number of admissions, what we're seeing earlier, but the patients that are getting admitted are staying longer. So the average length of stay, which for us used to be in the range of 3.2 to 3.5, is now closer to 4.7 to even 5 days. So what that means is people that are coming in are staying longer, and the kinds of cases that we're treating are on the more severe cases. So while if I extrapolate that on the numbers, it may achieve the same kind of normalcy. What it does mean is that we're still not quite back to the normal operating environment where we have, the outpatient to inpatient ratios that are, 8 to 9%. What's happening is that people that are coming in and they definitely know they're getting admitted. So our outpatients, for example, are only 60% of where they were in March, but the inpatients are close to 90%.
Sure. Tell me if this is a fair estimate, because it seems that the Cayman Island, most brokerages and analysts that we've been chatting with are estimating a 36% EBITDA CAGR for the Cayman unit over FY20 to FY23 on an estimated basis. Would it be a fair assumption, you think?
I would definitely desist from being able to comment too much on that. One is because it's difficult for us to give guidance. The other is that it's very difficult for us to say at this point whether this was a temporary blip, because flights haven't been operational and the huge number of patients that were going off island traditionally to hospitals in Miami and Houston have not been able to do so, and we've been able to capture a lot of that. as the case count comes down in the US and as flights open, it is quite likely that a good chunk of that will revert back to the prior thing, although there will be some amount of hysteresis there, and we will be able to sustain some of the business that was traditionally going abroad. But we don't, definitely fingers crossed, and we definitely know that with our investments in oncology, as well as getting into the primary and secondary care specialties, we'll be able to recover a lot of that. But there will be this lag period when, in the time it takes for the new departments to become fully functional and flights have opened up and mobility has resumed, where we may lag performance for possibly a quarter or 2 quarters. And so that, again, makes it difficult for us to be able to sustain the kind of outperformance in Cayman that we have seen.
All right. So when it comes to your flagship units, do you think that there is that sense of normalcy that you will see over the next couple of quarters? What's the timeline that you're drawing out?
It is a different kind of normal, and I'm sure every business has told you this. We are seeing cases come in that are a lot more serious than before. We're not seeing huge volumes of patients. We're not getting virtually no international patients. Most of this is domestic. So the kinds of cases that we're seeing, and this department-wise, the configuration is very different. For example, critical care, pulmonology, a lot of the acute care, emergency medicine, those are doing a lot more than what they were earlier, whereas elective cases have come down a lot to be replaced by more severe and emergency type cases that cannot be postponed. And oncology has really outperformed this entire time. So the mix has changed. And while the headline numbers have approached, hopefully by the end of December, we reach around 95% of the way there. I would say the way our business looks is going to be very different in future. Barring, of course, if things go back to normal, international flights reopen, and we can start getting that business back, then yes, then I feel a lot more confident saying that we're on a normal track. But right now, the constituents of our normalcy look very different.
All right, we'll let you go on that note. Appreciate you taking the time out, Viren, and giving us a sense as to what the outlook is for the company, as well as how things are likely to potentially return back to normal, as well as what the plans are for the Cayman business.